that people they want to know. Stem cells for bulging disc. Well, by the end of this video, you guys are going to know everything you need to know about stem cells and bulging disc. We're going to start here. So you need to make sure you have the right professional in the mix. The right professional is an orthopedic surgeon with as much regenerative medicine background as possible. This is important as this professional is going to be evaluating current MRI images and letting you know if it is in the scope of the work for the stem cells to help you, or if it is out of the scope of the work for the stem cells to help you. You see, it's a fine line, right? Not everybody can be helped. Sometimes it's in the scope of the work for the stem cells. Like if you're in the leaking phase, if you're in the compression phase, if you have a dehydration, a bulge, yes, this is in the scope of the work for the stem cells. However, if you are a little farther down the road, you have a herniation, it's deformed, out to oblivion, it's a structural issue, then no, this is not in the scope of the work for the stem cells to help you. To reiterate, very important to make sure you have the right professional in the mix, because this industry is full of patient advisors that are opportunistic, right? These guys are on a pay scale that is a commission-based pay scale. They'll almost say whatever it takes to get you through the door. Plus, there's a lot of complacent doctors that'll just practice on you. So make sure you guys are working with the right people. Make sure you vetted the doctors and make sure you get a fair shake during the classification. Let's say that you are a good candidate, okay? Let's say you got the thumbs up, you got the green light. Now, there's two different approaches that people are primarily rolling out with regenerative medicine when it comes to trying to treat the ruptured bulge split disc. So the first one is something called an intradiscal application. This is where stem cells are applied directly to the structure, okay? So even when this goes the right way, there's some pain associated with it, right? Because that structure does not like the pressure. So in the weeks and the months to come, after this treatment, people can find themselves worse off. Now, the other approach, this is the RegenaMex approach. We do a triple attack. So we're going to use intravenous application to systemically send cells to the region, okay? But then we also hang cells in the facets, and we also apply them intramuscularly. Okay, this is a complete approach that leaves people better than we found them every single time, okay? If you guys are interested in this, you want to know more, you're wondering if, your specifics will make the cut, please fill out a form on the website. Our orthopedic surgeon will be reviewing your file and somebody will be getting back to you in short order. Okay, so adios for now, RegenaMex.com.